Hello, thank you, welcome. I'm Sally, I'm one of the critical care nurse educators for Crit Care. Our 10-month simulation is hopefully what I'm going to talk to you about really briefly this morning. I thought first of all I'd give you a little bit of context of what it is and where it sort of fits into our education pathway. When we have new staff starting in critical care, for their first year they have sort of a bit of a conscribed pathway of learning study days, and we've tried incorporating sim into this. So it starts with their kind of initial, they have 2 induction days where they have a very loose introduction to the mannequin and what simulation is, and that we are trying to incorporate it in various stages, that it's not an OSCE, that it is to reinforce learning and good practices. And this is in their first sort of few weeks of starting. The first 2 or 3 weeks they should have this study day ideally. At about 6 months, they'll have some more study days with sort of theory and learning, and they have a day of simulation built into that as well. We call that the core module, and this is simulation that we do in our sim room on intensive care, so it's slightly more realistic. We build up on the fidelity of it. It's run by the CNEs on the unit, and we're sort of building into the level of the scenario as well, of kind of what's going on. The 10-month sim comes at approximately a year of being in critical care. So new starters get 8 weeks of supernumerary time. So that's 2 months. And then 10 months later, we have our 10-month sim. And this is what we do at the postgrad centre. It's a full day of simulation that we get into. And we make it as real as possible. It should be kind of the culmination of this year-long sort of induction that we have for our staff. Hopefully reinforcing stuff that they have learned and giving them opportunities to encounter situations that maybe they haven't, or they haven't had time to kind of sit, discuss and reflect on. We're lucky in critical care that I guess I won't take credit for setting this simulation day up. That was done by one of my colleagues that is no longer part of the team, but it was brought into the pathway kind of post-COVID, a restoration of practice. You know, I don't have to hopefully justify to this crowd the simulation is a good method of learning, but it is, we're lucky that our intensive care society and GPICs kind of recommend simulation as well. So the question is always sort of why aren't we, rather than how or why should we when it comes to sim. So the course itself, it's a full day at the Sim Centre, 8-hour study day. Before the day, a couple of weeks before, we give them some pre-course information. So they have a workbook which sort of explains what simulation is, what they will expect on the day, what is expected of them, that it is not an OSCE, that this is a chance to learn and make mistakes safely. They're also given a pre-course knowledge quiz, which is what they get at 6 months repeated, so hopefully a bit of a refresher. On the day itself, we spend a lot of time sort of introducing and ice-breaking with the postgrad team and with ourselves, and they have a safety briefing. We also have a tour of the sim room itself. I know some simulations kind of go straight and start with the sim. We spend a good hour and a half in the morning kind of setting our staff up for the sim, as we found that I think a lot of the nurses are quite worried about simulation. They're quite worried about what their peers will think and getting involved in it. I don't know if it's a critical care specific fear of lack of control, that things aren't set up exactly where they would need them. So giving them that time to kind of ask where they'll find things and how things will be setting up, and just showing them the room kind of has helped dissipate some of those sort of fears, I guess. Then we run 4 simulations with debriefs, and we have 1 simulation followed by a workshop and then the staff evaluation. To touch on some of the pre-simulation work that we do, so this was kind of one of the things I guess I learned whilst doing this project was a lot of our nursing staff have varying experience of simulation, and they're not always, this may be their first experience, then this may be something they've not done for many years, this may be something that they have only ever done in an exam type OSCE situation. So trying to shift that sort of experience to one of learning and less pressure has been kind of a bit of a cultural challenge. But by giving them those kind of materials in order to give them some context has been helpful. I think doing those icebreakers and getting people talking beforehand has been really helpful, and trying to make it a day of reflection and conversation rather than sort of picking out mistakes, because that's not what we want for them. And as well, I think one of the things that has been successful in that and taking them and touring them around the unit is that it kind of has prevented this sort of for the most part anyway, the acting rather than reacting, if that makes sense. People sort of putting on a show because it's simulation and they feel they should, rather than just acting how they would in everyday practice. Some of the evaluations and stuff have been really positive. Generally speaking, everyone walks away, or most people walk away, happy customers. They don't get a lot of time out of practice to do study days, so when they do get it, most people are, after the initial concerns that it is simulation, they think they're all going to be examined. At the end of the day, can reflect and for the most part, give us some positive feedback. I think we've tried to tailor our simulations to the different areas of critical care as well, to try and keep it applicable for high dependency unit and the different specialities that you see at Queen's and City, whilst giving people exposure in terms of those debriefs to other specialities and situations that they might not have come across. So that has been one of the challenges when we have a group of staff that is particularly from one area, and making sure that what scenarios we have are still appropriate for them as well, and that we're not putting them in a situation that they wouldn't be in practice or have no idea of in practice. So we've managed to wiggle that around and have enough sort of variation, I think, in the topics of the sims to be able to do that. Most of the time we get a raise in confidence post simulation as well. I think there's very occasionally been the blip where staff feel that they are less confident, but when speaking and following up with them, it's more of that I now realise how much I don't know, that kind of conscious incompetence, which is still a positive in my view. And sort of sharing with them the depth of kind of the actions of why we're doing what we're doing, which has been really valuable from the debriefs. I guess some of the key lessons that we've learned through this then. So particularly from a nursing point of view, the preparation for the sim and the psychological safety and making sure that people are, fully engaged in what we're doing has been really key, and kind of setting them up for that. Communicating the purpose of the simulation with the operational staff. So there's some of the challenges that we faced when coming back into practice is for those that are potentially on action plans or needing extra support within practice, that are maybe needing more educational study days or input, having them sort of referred back to the simulation day as a marker of competence has been potentially a bit contentious, as this is supposed to be a safe space where people are allowed to make mistakes and learn from them, and not an examination of where they are in their competence level. So that's been, I think, is an ongoing sort of our view as an education staff of what this day is about versus maybe operational clinical staff can vary, and just having that kind of conversation still. It doesn't have to be complicated to be great. I think when looking and creating the scenarios, sometimes simple is best. We can come up with some really elaborate situations, but actually the simple ones kind of give you a lot to discuss and go on, because it's not really about necessarily the scenario, but it's how people respond to it, which has been a lesson learned for myself when trying to bulk out or think of more potential scenarios we could have. And one point to take away as well is sometimes I think initially when starting, we were very faculty heavy because as a team we wanted to have some resilience with our education team in debriefing and simulation because it's not something that as a team we've had a lot of exposure to prior to this, at least outside of the critical care area. And there have been some days where we may have like double the faculty in the candidate versus the candidates in the debrief room, which, I can understand is potentially quite intimidating for some of the staff. So we are finally paring back on some of the faculty and sort of appreciating it from the candidate's point of view as well. I think that it's, this day is about them, and although we can be very enthusiastic, sometimes less is more. And that is a really whistle-stop tour, I'm afraid, of what the 10-month sim is. Hopefully it may have sparked more questions